Okay, let's continue the medial corticospinal tract. And the function of this was to control the proximal part or axial part of the upper body. So we just type function here, control proximal and axial muscles of the upper body. The example, the scenario we're given is one arm dumbbell press, shown in this picture, and in order to do that we need to contract the pectoral muscle and also shoulder muscle. So you're going to use, this is our right side and left side, and right side and left side. So let's use the right side pec muscle. And for a medial corticospinal tract, similar to the lateral corticospinal tract, we need to draw the two neurons, and one is already drawn, or zoom that in. If you see the blue neuron is our lower motor neuron, and it innervates the muscle of the chest. And it goes through the ventral horn, so we can label some of the parts here. Sorry, ventral root, not horn. And the cell body of the lower motor neuron is found in the ventral horn. So you can say this is the ventral horn. Change that. And now let's draw the medial corticospinal tract. So before we go up, that's right here, it's the alpha motor neuron, which innervates the chest muscle, pectoralis major. And let's go up, and this time we can start whatever what side you want. You can start from right side or left side. Why? Because the medial corticospinal tract is has the bilateral innervation. So let's just use the right side, right brain, to start this tract. So the soma of the cell body is found near the homunculus, which controls the upper body, the chest area, and the axon goes through this tunnel called the internal capsule, same as the lateral corticospinal tract. Capsule. And that was the example of projection fiber. Goes through the same route, which is the cerebral peduncle in the midbrain and pons, and pyramidal tract in the medulla, open and closed medulla. And it stays in the same side and reach this area in the medial corticospinal tract in the spinal cord, and synapses with the lower motor neuron at that level. So let's label those parts. Cerebral peduncle, and pyramid, and in this medial corticospinal tract you don't see the decussation in the junction between the medulla and the spinal cord. The other term for medial corticospinal tract is anterior corticospinal tract, because of the location on the spinal cord that's anteriorly located. So that's the same term. One thing you recognize is it's a bilateral innervation. Why? Because it can actually decussate at the spinal cord level. So if I draw this, zoom in and in the spinal cord level. It can have the collateral branch go to the other side of the medial corticospinal tract, and sinus this with the lower motor neuron on the opposite side. And that's that decussation occurs at the spinal cord level, and that's why the medial corticospinal tract is said to be bilateral innervation. So this upper motor neuron makes the bilateral projection, and can activate the opposite side as well. So in the brainstem, you don't see the decussation, but you can see the decussation at the spinal cord level. So bilateral innervation. And I wrote this 15% and up to thoracic level. And what it means is that this tract is only found in the thoracic, up to thoracic level, because this is controlling the upper limb only, upper body only, sorry. And this 15% means that it takes 15% of the volume of the corticospinal tract. So if you combine lateral and medial corticospinal tract, we have this corticospinal tract, and 85% is the lateral and 15% is medial. So you can see, you can imagine the 85% of the tract decussates at the junction between the medulla and the spinal cord, and the rest stays on the same side, but decussates at the spinal cord level. So let's zoom that out, and that's the medial corticospinal tract. We have to label that first part, which we can find the soma of the medial corticospinal tract. Same with the lateral corticospinal tract. It's found in the primary motor cortex and premotor cortex. So in any pathway drawings, make sure you indicate left and right, and also indicate the parts of the soma and the axon terminal. So for example, this is the soma, and we label this, the soma can be found in the primary motor cortex or premotor cortex, and also parts of the axon that is important to indicate, so such as internet capsule, it goes through the cerebrum, and also cerebral peduncle in the brainstem, pyramids in the brainstem, and also the synapsing part, which is the ventral horn, and the axons of the lower motor neuron, which is the ventral root. So that's our medial corticospinal tract. So for lateral and medial corticospinal tracts, you can actually come up with any scenario with your friend, and just make it as a quiz or a question, and try to just draw the pathways according to that scenario, and that will help tremendously to prepare for the final exam. The last objective for today was the innervation of the face area, and this is done by Corticobulbar tract. It's a voluntary motor control for the facial movement, and facial movement specifically is governed by cranial nerve number 7. In other words, we're going to draw two neurons, upper motor neuron being the corticobulbar tract and the lower motor neuron being the cranial nerve number 7. And the scenario we're given is smiling. So this is the smiling face. So how do we smile? And for the innervation of the face area, we need to know one additional aspect of this, which is the difference between upper face and the lower face. So it's color-coded in this area. Upper face is bilateral innervation. And lower face, the quadrant of the face is contralateral innervation. And this is often seen in the stroke patients. So when the cortex area of the motor cortex is damaged, they might show, when you ask them to smile, they might show this drooping of the one side of the lower face. So this part is smiling. Well, you can see this part is smiling as well, but not this part, which is the right side of the lower face. And from this clue alone, we can actually say, because there's a contralateral innervation, possibly the damage was in the left side of the hemisphere. So she is likely to suffer from the left side hemisphere cerebral accident. So for this diagram as well, because only this part is smiling, you can say left part is not functioning. It's only showing the right side innervation. So let's actually look into how the upper face and lower face is innervated in this situation. So in the right side. So right side is controlled. So right side of the cortex is drawn here. And we're going to use this homunculus that represents the face area, specifically the upper part of the face area. And it goes through the internal capsule, just as the lateral and medial corticospinal tract. So that's the internal capsule. And it will end up in the lower motor neuron area, and specifically that area is our nuclei for the cranial nerve number 7. So this is the nuclei for cranial number 7 in the brainstem, and that's where we can find the soma of the lower motor neuron. So that's our alpha motor neuron that has direct connection to the face muscle of the upper part. And you can write additional information that this is the cranial nerve number 7. Nucleus. They will find the soma. Sorry for the typo. Nucleus. So because it's bilateral, one part will innervate both part of the cranial nerve 7 nucleus. So we can draw 2 neurons that starts from the forehead area, goes through the internal capsule. One goes to the right side of the facial nuclei and the other goes to the left side of the facial nuclei. So we will see the decussating neuron for this upper face area, and the axon which is not decussating. So both area of the face, side of the face, is innervated by the right side of the hemisphere. And this is the branch of the cranial nerve number 7. Which will have the direct connection with the muscles of the face. So that's the upper body, upper face. Lower face innervation is contralateral. Which means if we want to activate the left side of the chin area or mouth area, we have to activate the right side of the brain. So this is the right side of the hemisphere, and homunculus we're going to attack is this lower face, lower part of the face. It goes through the internal capsule, same with the upper face. It's internal capsule. And it decussates in the brainstem area and goes to the opposite side of the facial nuclei. And this facial nuclei contains the soma of the facial nerve, and that innervates the muscles of the lower face on the opposite side. So because this axon decussates, there's contralateral innervation. Let's just label some parts here. So it's internal capsule, and that's the decussation. And areas where you can find the soma of the lower motor neuron is our cranial nerve number 7 nuclei in the brainstem. So that's our corticobulbar tract. The example is for the facial expression, so bilateral for upper and contralateral for lower motor neuron. Okay, so that's it for today, and if you have any questions, I'll just put the link in the about the description of the video in the YouTube. It's anonymous, so you can just write any statement in regards to today's lecture. Alright, I'll see you next week.